Since the NHS was first established in 1948, I think we've seen vast changes, developments, evolutions in healthcare generally, but more specifically in diabetes, I'd probably put the changes, which have been vast, into three categories. The first is changes in our population of people with diabetes in terms of the population demographics that we see. The second is the technologies that we've seen evolving over the last 70 years. And the third is the improvements in the outcomes for people with diabetes, the way in which life has improved for people who have the condition, who have type 1 or type 2 diabetes. So if I start with the first, back in 1948, diabetes was relatively uncommon, and the majority of people suffered from the majority of people had type 1 diabetes. Type 1 diabetes is an autoimmune condition. The immune system attacks the cells in the body that produce the hormone insulin, such that people require insulin injections to sustain survival. It has no relationship to lifestyle, and so back then in 1948 we already had available by injection, but it was animal insulin. The injections were via glass syringes and needles that needed washing between injections, and we've seen huge advancements since that time. But in terms of the population demographics, in 1948, of course, we were post-war, food was still rationed, and the focus was really on undernutrition. Over the ensuing decades, we saw a real change there in terms of food availability, such that by the mid-1970s the problem had swung more towards overnutrition and people eating more than they required. Indeed, by 1975, for example, we had 5 to 10% of the population by then obese. And so now we're looking at 25 to 30% of the population are obese. 2/3 of all adults across England are overweight or obese. And being overweight is the major modifiable risk factor for type 2 diabetes, so that now we see much greater number of people with type 2 diabetes related to those lifestyle changes. 90% of all people with diabetes now have type 2 diabetes, so that type 1 diabetes forms the minority of people who carry a diagnosis of diabetes. So huge changes in the demographics, and that's played out not just across England. We've got about 3.5 million people with type 2 diabetes now across England. That's in the region of 8% of the entire adult population, but it's playing out across the world. We've got 422 million, that's almost 500 million people across the world now have diabetes. The evolution and the changes in population demographics have changed the numbers involved, changed the relative balance of type 1 and type 2 diabetes, and changed the burden on the health service as well, obviously. So both type 1 and type 2 diabetes are associated with nasty things happening to people. So the complications of both forms of diabetes are not very nice. Common cause of blindness, of kidney failure, of amputation of the leg, of heart attack, of stroke, and of compromise to life expectancy. So the impacts on individuals are really significant, but the impact on the health services is huge as well. It was estimated a few years ago that we were spending around 10% of the entire NHS budget per annum on the care of people with diabetes. So the increasing numbers, particularly with type 2 diabetes now, is having implications on sustainability, not just of the NHS, of course, but of all health systems across the world.